Good afternoon, everyone. My name is Jessica Lair. We are here for the Medicinal Cannabis Program Town Hall meeting, and we are about to start. I would like to introduce Acting Executive Director Chris Riggs. He will start off this meeting.
Thank you, Jessica. And as Jessica stated, I am the acting executive director here, and it's exciting to talk to the stakeholders, medical patients, doctors, caregivers about our medical cannabis program. I've been the acting executive director for almost a year now, and have also served as the former chief counsel here at the commission. So I've been charged with setting up the adult use regulations, working through some of the medical issues here as an attorney. There's really two issues that I want to start talking about first, and then I have some slides and stuff to present to you on data points to tell you about our medical cannabis program, and then really just interested in hearing from you, hearing the issues that you're having, hearing some ideas that you may have as we continue to look at the medical program and rewrite the rules for the medical program. The first issue I want to raise is pricing. Pricing always comes up, and unfortunately, the Cannabis Regulatory Commission does not have any oversight over pricing for cannabis products or the tax rate that is set for medical cannabis. Each business sets the price. The tax rate is the tax rate that we see in the law in the Jake Honig Act, and we do not have any purview over setting prices for medical cannabis. The second issue, and I know everybody wants to talk about this, is home grow. Home grow is outside of the purview of the CRC. Without any enabling legislation and without the law being changed, the CRC cannot authorize or regulate home cultivation of medical cannabis. Instead, what we do is we encourage you to go to your lawmakers and talk to them about home grow and see where things go. Next slide, please. So some of the things that are coming for the future of the medical program, we have clinical registrants and clinical registrant rules in place. We're going to establish a review board that's going to be able to petition and allow for additional medical conditions to be authorized for medical cannabis. We're looking into establishing a reference lab and ultimately reviewing the medical rules, and that's really why we're here today, to look at the medicinal cannabis program, look at the rules that govern that program, and see how we can help patients, because patients are always at the forefront of our minds when we're thinking about medical cannabis rules and the cannabis program. But we really want to hear from you. We want to hear from the patients, caregivers, all the people that have any interest in about their experiences with this program. So I'll go over some data slides now, and then we'll get to the good part where we get to hear from you and answer questions if we can. So the highest number of patients that we've ever had in the program was just under 130,000 patients, which was in 2022. There were about 5,000 caregivers and almost 1,400 providers. In February of 2025, we see about 68,000 patients enrolled, 4,400 caregivers, and an increase in health providers to over 1,500. One thing that you'll notice here is that there has been a reduction in patients in the program, but that's not uncommon for states. We hear from the other states that have medical cannabis programs that ultimately went to an adult use marketplace and have also, kept their medical program. And it's not uncommon for the medical market and the patient numbers to go down once there's a launch of an adult use market in any state. So there is that decline, but we're looking to bolster those numbers and make sure we're taking care of the patients that are currently enrolled. This is an active patients by region. As you'll see, the yellow here represents South Jersey, the Central Jersey is in blue, and then we have North Jersey here in green. 41%. So most of our patients are residing in Central Jersey, South Jersey coming in second place at 32%, and North Jersey at 27%. This next slide is the dispensaries that are serving medical patients. So it's broken up by region. We have over 15 dispensaries serving medical patients in Central, South, and North Jersey. The licensed dispensaries serving medical patients are as follows. In Central New Jersey, there's about 20. Ocean, Monmouth, Mercer, Union, Somerset, and Hunterdon are included in those. They're the counties that are included in that central Jersey location. I know there's an argument if central Jersey really exists, but there's 20 dispensaries serving medical patients. In the southern portion of New Jersey, we have 18 dispensaries serving medical patients, and in the northern region, we have 15 serving medical patients. This is healthcare providers by county. You see every county here listed on the bottom, and Bergen County up in North Jersey currently has the most registered healthcare providers in the program, with 223 providers registered with our program. Essex County has 157 registered, and Monmouth County in central New Jersey has 151 providers registered. We have heard a lot of challenges for patients in the program, and some of the things that we've heard for the reasons that these folks leave the program are high fees charged by a healthcare provider to get your authorization, high cost of buying cannabis legally, and there's just no medical dispensary nearby. Some of these challenges are with the program or outside of our purview, but we have been doing what we can within the law to facilitate access for all medical patients. Patients' rights. So some of the patients' rights that we see here, patient-only parking. So exclusive parking options need to be available for patients and caregivers during the operating hours of expanded alternative treatment centers. Patient-only checkout lines. So, you know, you have the point of sale systems for the adult use folks, and then you have your patient-only lines. There need to be exclusive lines for patients to check out, get their medicine, and move through the process quickly. Authorized product needs to be reserved for the patients, so they have the ability to reserve products in advance to ensure that that product's available and to ensure that they can get their medicine. And then we have safe quality products. Medical cannabis patients can request a certificate of analysis, which is going to be your lab results. Every single test that's done by our licensed labs, there is a certificate of analysis generated for each strain, batch, and lot number. And you'll be able to identify the cannabis products and what terpenes they have and things like that that may help your condition and may be the medicine that you actually need. Next slide, please. So the cost of medical cannabis, we get a lot of complaints. I talked about it at the onset of pricing. Some of the changes in cost for medical patients, some of the things that we have control over here, or the state of New Jersey had control over in legislation. State sales tax was eliminated in July of 2022. In December of 2023, we reduced the registering patients and caregivers could get their card for a reduction for $10. March 2024, we went to free digital cards and $10 for a physical card. So that's where we are as far as trying to change and reduce costs for medical patients. Sales by product category. You know, you see, I want to go back to the last slide first, please. So we're going to look here at changes in cost. So I wanted to mention that as more dispensaries open up and the market sees more price, you know, more people coming in and competitive prices going down, we're going to see the prices reduce, and we've actually seen that. The average cost of flower for medical patients has decreased each year since the legalization of recreational cannabis. Next slide, please. Now we're looking at sales by product category. These are the medical sales. You'll see, you know, the pre-rolls and things like that. A little bit of a reduction here in 2025 because of the reduced patient numbers, but this is broken down by product category to see. And obviously, bud and flower are really dominating the medical market still and have been since the beginning. And here we get into the cost and the average cost and bringing the cost down. As I mentioned, the average cost of flower has decreased each year since the legalization of recreational cannabis. In 2023, the average price for medical patients was $11.75. And then that reduced in 2024 to $10.48 per gram. And in 2025, we were actually under $10 at $9.29 per gram. So with that said, we are going to open up the floor to the public comment period. There's some instructions here up on the screen. It's 3 minutes per speaker. If you're on the phone, to raise your hand, it's *9. To unmute is *6. Try to be as concise and respectful as possible. Stay on task. We want to talk about the medical program. We want to hear from you. So just try to continue to talk about the medical program. Do not use this time to market or advertise any private businesses. And remember that you can submit any comments that you have in writing. It's not just this meeting. You can submit your comments. The website's given right there. But really excited to hear some of the things from the medical patients, doctors, caregivers, and all the other stakeholders that are on the line. Looking forward to this public comment portion. And with that, I'll turn the floor back over to you, Jessica.
Thank you, Chris. All right, so we are going to start calling names. I will call 5 at a time. If you hear your name called, please raise your hand and we will unmute you and you may begin to speak. I do apologize if I mispronounce anyone's name. So the first 5, I have Robert Devine, Misty Schworn, Paul Labus, Russell Lash, Adam John Wilpert. Again, Robert Devine, Misty Schworn, Paul Labus, Russell Lash, and Adam John Wilpert. All right. I see Robert Devine. Okay, Robert Devine, you can speak.
All right, great. Hello, and thank you for taking the time to hear my concerns. I've been a medical marijuana patient in New Jersey for over 5 years, and I've seen the transition from the medical-only market to the medical and adult use market. Since then, the number of patients in the program has drastically decreased, as we saw in the slides previously, a nearly 50% reduction, because rather than making medical cannabis more accessible and more affordable, adult use simply did the opposite of that. Most products in the state are designated as adult use products, meaning a medical patient has to pay tax on their medicine. Regardless of its labeled as adult use, medical patients should have access to any and all cannabis products in the state without having to pay tax on their medicine. I think there should be a change made where if you present your medical card at any NJ dispensary, that any taxes are removed from your order. While talking about taxes, when the legislature decided that medical patients should not be paying tax on their medicine, it was a great move. But then, months later, a 2% municipal tax was added to towns who wanted to enact it, which applies to medical purchases. So if the legislature deemed medical patients should not be taxed on their medicine, then why is this new 2% tax okay for them to pay? Another item I would like to address is edibles. 100 milligrams of THC and 10 milligrams per piece maximum is simply not enough for many medical patients in the state. Many patients will need well over 100 milligrams, sometimes double that for positive effects, and having to eat 20 gummies is not the answer. Medical patients should have access to higher dose and larger quantity edibles. While I know it's not under the CRT's discretion and that would need to be a legislative change, I still have to bring up the fact that growing a single cannabis plant in NJ can land a medical marijuana patient in prison. This is simply absurd. An overwhelming majority of states with medical programs allow their medical patients to grow at least a small number of plants. Even simply decriminalizing it would go a long way. Yet NJ just keeps up the status quo that it is a felony, and that is insane in a state where the plant is legal. I also would like to express my concern about Senator Scutari's recent bill he introduced, Senate Bill 4154. Trying to recriminalize cannabis in any respect is moving in the wrong direction. This bill will simply make minorities get targeted again at an overwhelming majority as they were in the past, and will simply make no dent in the people who shop the quote black market. We should be looking to improve the adult use of medical cannabis programs in our state, not go backwards and make both programs worse. It's also trying to make it so medical products can be transferred over to the adult use products, which would lead to even less products for medical patients. Adult use products should be available to be transferred to medical products and not the other way around. Another suggestion I have is to get rid of allotments for medical patients. It seems silly that I can buy unlimited cannabis on the recreational market at 1 ounce per transaction, yet I'm limited to 3 ounces a month as a medical patient. Due to the very high prices in the state, I have to constantly check dispensary websites for deep discounts. These discounts generally have to be jumped on right away to secure them. So when my allotment is full or near it and I'm unable to get the lower price items I see, it affects the amount of medication I can get in a given month. Pricing and
Oh.
NJ.
Okay, Robert. You can wrap it up. We're at the 3-minute mark.
Okay, great. All right, in conclusion, medical patients in the state seem to have been left behind with the adult use program because we don't bring tax money into the state. So I just believe that the medical program should incentivize businesses to open medical dispensaries rather than the CRC currently not having an option for a business to even apply as a medical dispensary. Thank you for taking the time to hear my comments today. I appreciate it.
Thank you, Robert. And if there was anything else that you wanted to speak on, you can submit it in writing also as well, okay?
Yep, I appreciate it. Thank you.
Thank you. All right, so we will move on to the next 5.
That's what I did. Yeah, you're trying to, you got.
The next 5 are Timothy Barnwell, Stephen Markman, Ramona Sokolovsky, Mark Megna, and Mary Esser. Again, those names are Timothy Barnwell, Stephen Markman, Ramona Sokolovsky, Mark Megna, and Mary Esser. All right, I do not see any of those. The next 5 are Michelle Kidd, Anthony DeMeo, Alan Shapiro, John Wise, and Calvin Riggins. Please raise your hand if you're in the room. I'll say those names one more time. Michelle Kidd, Anthony DeMeo, Alan Shapiro, John Wise, and Calvin Riggins. Okay. The next 5, Mark Williams, John Joseph Havlicek, Russell Kaufman, Paulie Richard, Stephen R. Satile. Again, those names are Mark Williams, John Joseph Havlicek, Russell Kaufman, Paulie Richard, and Stephen Satile. Okay, we do see a couple people. Mark Williams, you are first.
Hello.
Yes, we can hear you. Go ahead, Mark.
Hi, Jessica. How are you? All right. So I just in listening, and especially with the email that was sent for the invite saying to stay on topic, I may be on the wrong platform here. I'm a medical patient. I am a lifelong agoraphobia person that has agoraphobia. There are sometimes I cannot even leave my house for a week at a time. When I passed away in 2021, I had a brain hemorrhage, and it has gotten to the 20th power worse. So I don't know what to do. It said you want to hear from patients, so I'm speaking on that. Other than that, the sales tax, I think I'm still being charged. I use something called RSO, which is called Rick Simpson oil. It's a THC oil. It's restricted access to it because it's a high potency product. Right now, I can't even afford to get it. I at least stocked up a little bit, but I am not sure. I was downsized at the end of last year in 24 after a 20-year career of working remotely, and I worked remotely because of the fact that I have agoraphobia. And I went back to work after 21 for 2 years, but apparently I had things wrong, but I don't know if I can get state disability or Social Security. I think at this point, after breaking my brain, okay, that I should at least be able to get some kind of retirement or Social Security after working over 40 years as well. And I don't know how to do that. I don't have any family. I don't have any friends. I was an abandoned child. I raised myself since 14. So I'm sorry if I'm taking up time on this platform, but I don't know what to do or how to go about it because I'm actually running out of unemployment right now. I have a mortgage of 19 years that I have nowhere else to go, and I was hoping to plant roots where I am and leave this earth here. But I don't know what to do, Jessica. So, and I apologize, and I'm not sure. I missed the first 2 minutes. I was a little late to attend, but so I don't know who that speaker was. That was the initial speaker. But I apologize. I don't know his name. But other than that, I'm not sure what to do right now. I'm literally jeopardizing my whole home and everything at this point. If I don't find something, I would go back to work, but I feel that I really should not be forced into doing that. My left fingers, and 3 of them are numb. You can hit them with a hammer if you'd like. I can't button buttons. I cannot tie my shoes. My daughter used to tie them, but she lives with her boyfriend now. And I can't zipper zippers. I can't hear out of my left ear so well. I can't see out of my left eye so well. So, and these are, I don't know what qualifications are for, but I'm 60 years old now. So, and I only have a few more years, I think. I don't know what laws are to get Social Security or what have you, but I don't know what to do. So I'm turning to this platform because it's my only option for people to hear me. Aside from that, not to throw it in and change the topic for what we're discussing, but I just spent the last decade of going through a living hell of having somebody that is state mentally certified as mentally incompetent chasing them after my children, and I just got my daughter back for 3 years. They charged
Mark,
her. Yes.
Mark, sorry to cut you off. It has been 3 minutes. We do appreciate you sharing your story with this platform. If you do think of anything else that would pertain to the program, you most certainly can write it in. The form is on our website. So you most certainly can write in the comment also as well. Thank you again for sharing your story.
Can somebody actually give me some guidance or what I should do in order to pursue something here?
So unfortunately, I do apologize. We do not have any resources for you at this
But you are
time.
the
I'm sorry.
state, so can't the state tell me what to do of how I should try to save my home, financial structure, and my life after dying for 31 seconds and breaking my
Oh,
brain? And
okay.
then trying to go back to work and then trying to work for 2 years and
Okay.
being
Okay.
told that I cannot do my job anymore. I was literally
Okay.
terminated.
Okay. So what we'll do is I have your information on the registration sheet. Someone here is going to reach out to you. Okay.
Thank you kindly. I would really appreciate that. And I apologize. I have nobody. I
No
go,
problem.
I can't even get to the supermarket sometimes. And if I don't find something to do within the next couple months, I am going to lose my home. Okay. I know the state probably likes that for FEMA or for the FHA or
Okay,
whatever, but
okay,
I
sir.
would
Yes.
love to die in my home comfortably,
Okay.
please.
Someone will be reaching out to you after this meeting. Okay.
I was
And have
actually told.
Okay. Thank you again, Mark Williams. And the next person with their hand raised is Stephen Satile. You may go forward.
Can you hear me? Hello? Can you hear me?
Yes, we can hear you, sir.
All right, good. Thank you. My points are about education. I've been using the medical program for about 4 years following an accident, and I'm finding that you've got some very strong products being sold in the medical program. And I'm reflecting, when I first started using marijuana as a young man, I'm 63 now. there's maybe 25% THC, but you've got some of these vaping products that are 80% more. And there's very little research that I've been able to find on the long-term impacts of these things and how to use them safely. I myself had a psychotic episode using a vape, and I just did too much of it. And I'm just thinking that we need to be more proactive in helping patients use these products. The second thing I'd like to reflect on is having to change the password for the site every couple of months is really annoying. Is it possible to set it up with biometrics or to do two-way authentication like you do with other programs? Those are my comments. Otherwise, I'm very happy with the program.
Thank you, Stephen.
You're
Okay,
welcome.
thank you. Thank you. Yes, thank you, Stephen. I'm going to call the next 5 people. I have Nathan Salmos, Ricardo Rios Velez, Kimberly Ann Denoya, James J. Biddick Jr., and Rashawn Whitaker. Again, those names are Nathan Salmos, Ricardo Rios Velez, Kimberly Ann Denoya, James J. Biddick Jr., and Rashawn Whitaker. I see Nathan Salmos with your hand raised. The floor is yours, sir.
Hi, thank you. Just a confirmation you can hear me?
Yes, I can. Sorry about that. Yes.
Thank you. I really appreciate the forum. This is great. I'm one of the patients that was in medical for, I would say, 3 or 4 years, and I just recently went to just dropped my medical license, and I'd like to explain why, because I think it is important to understand the dynamic going on at these dispensaries. So first of all, my doctor and I created a very specific terpene and cannabinoid regimen for my condition, and it worked. It worked very well. I won't go into the details, but that regimen down to the terpene level was something that worked, right? My first comment is that the earlier dispensaries were actually very sensitive and informative, but now it's just a wild west. There's dispensaries, they don't care, they don't take, it's not the same service and advisory that I got in the dispensaries, number one. Number two, all of those strains that were giving me the terpenes that I needed disappeared from the market. I have no idea what happened to them. And they were replaced by these fancy hybrids that offer real no value. They're probably overbred, over GMO'd, and they don't have much value. Also, when we turned from medical to recreational, I noticed instantly a significant drop in quality, probably due to the curing process being rushed or whatever the case is. The manufacturing and curing is just garbage now, to be perfectly frank. And I couldn't find the strains I needed. And then if I could find the strains, the lab analysis is very inconsistent. There was one dispensary that did amazing lab analysis, and I guess they went out of business, which is very hard to believe, but I guess they went out of business. And so I think having a statewide lab analysis requirement down to the terpene, the percentage of terpenes, the percentage of THC, I don't trust it whatsoever. I have no confidence in their analysis. And so I think beefing up and maybe putting some standards around the analysis would benefit medical more than recreational. Recreational people don't really care, except the THC percentage. And so I just wanted to explain myself. I guess the reason why I dropped my medical license was really the strains that I needed for my condition were no longer available. They just disappeared, and they were replaced by things that didn't help me. And then maybe maybe I could find strains that could help me if the lab analysis was more robust. And then finally, I guess my last reason is, which isn't this didn't play a part of my decision, but I do want to reemphasize the quality has gone down. In the early days, medical only, very high quality, and now it's indistinguishable from I don't know what. It's just not distinctive anymore. And
Thank
so yeah, that's
you.
what I wanted to
Yes.
share.
Thank you. Thank you, Nathan, for speaking.
All right, welcome.
All right, the next 5 names are Johanna Clark, Kara Lippincott, Denise Santiago, Sandra Jennings, and Ashley Dennis. Again, those 5 names are Johanna Clark, Kara Lippincott, Denise Santiago, Sandra Jennings, and Ashley Dennis. All right. I don't see any hands raised. The next 5 names are Walter Anderson, Jane Young, Melody Brown, Chantel Frazier, and Ray. Someone with Ray NJNY. I'll say those 5 names again. Walter Anderson, Jane Young, Melody Brown, Chantel Frazier, and Ray. Do not see any hands raised. The next 5, Patrick Childs, Ralph Moesner, Kimberly Tedros, Thomas Kanzler, Chris Lenny. Again, those 5 names are Patrick Childs, Ralph Moesner, Kimberly Tedros, Thomas Kanzler, Chris Lenny. No hands are raised. Again, if you're on your phone, to raise your hand, it's *9, and to unmute, it's *6. Next 5 names, Ella Ree Prey, Thomas J. La Tourette, Walter Anderson, Sean Woods, Malcolm Hunter Sr. Those 5 names again are Ella Ree Prey, Thomas J. La Tourette, Walter Anderson, Sean Woods, Malcolm Hunter Sr. Okay. Next 5 names, Teresa DiLorenzo, Frederick Robinson, Rennie Rankin, Elizabeth Estergren, sorry if I mispronounced it, Marianne Brandreth. Those 5 names, Teresa DiLorenzo, Frederick Robinson, Rennie Rankin, Elizabeth Estergren, and Marianne Brandreth. Okay, I see Rennie with their hand raised. Rennie, the floor is yours.
Hi, can you hear me?
Yes, we can.
Okay, hi. Thank you for allowing me the time to talk today. I am an original OG card holder since the very beginning. And I have to say that for me, the program has gotten a lot better. I go to a medical only dispensary and their quality remains high as it was from the day I started going there. I think that it's important that we maintain medical only facilities because the recreational facilities, I feel like the quality just is not as good, and nor are the people that work there as knowledgeable. I do think that there is a stigma for providers. I have multiple sclerosis, and I was with an MS specialist who was a provider, and people like his peers called him a quack or whatever. And I switched providers for other reasons. And my new MS specialist does not participate as a prescriber. So I have to use VeriHeal, and it costs me $250 to do that. I appreciate the lowering of the cost as far as renewing the card and getting my prescription But that appointment for $250 is a lot. I'm on Social Security disability. That's my message to Mark. Go on the Social Security website. Sorry not to get off topic, but he sounds so desperate. And if you're not working, you can apply for Social Security disability income. So
Thank you for that, Rema.
I do appreciate also the fact that I don't pay sales tax at my dispensary and I get a discount because I'm on SSDI. So it is convenient. I watch for sales and then I can combine it with my discount. And that's when I go and stock up. So for those of you that find the cost exorbitant, which it can be, those are the tricks that I've used over the past, I don't know, what is it, 12, 13 years since this became a thing. And I was in it from the very beginning. And so, yeah, I just wanted to thank this program because it has definitely made a difference in treating my symptoms and my condition.
Thank you very much, Rennie, for sharing.
Thank you.
All right, I will read the next 5 names. Tiasi Braylon, Jarvis Bestman, Thomas Camont, Beverly Green, Michael Robinson. Again, those 5 names are Tiasi Braylon, Jarvis Bestman, Thomas Camont, Beverly Green, Michael Robinson. All right, no hands raised. The next 5 are Joseph A. Klenner, Ehab Abu Hassan, Florence Mello, Robert J. Ciano, Miles Farrell. Again, those names are Joseph A. Klenner, Ehab Abu Hassan, Florence Mello, Robert J. Ciano, Miles Farrell. Oh, I do see Thomas Camont, your hand is raised. The floor is yours, sir.
Can you hear me?
Yes, we can.
Okay, good. I wasn't quite sure if my microphone was muted. Thank you for the opportunity to talk to you today. My main concern is costs. I have been on medical marijuana or cannabis for probably over 3 years. I have PTSD, severe arthritis. I'm a veteran, so the VA cannot prescribe it for me. But my GP finally said, go for it, because every medicine I've been on has sent me to the hospital with side effects. This is the only thing that works for me. I don't need a lot. I don't need strength, but things that I are used to using, because I only do edibles. I had to quit smoking because of a heart attack, are coming off the market. They're no longer being made. And I asked why, and they don't know. The company stopped making nano drops, which worked great for me, but they're not there anymore. And the costs are going up. So I go from dispensary to dispensary, finding a better price. I do get the veterans discount, the senior discount. I'm on a fixed income right now. The costs have been going up progressively. As people were talking about the quality of cannabis out there, the flowers, yes, I can understand. They're mass producing things and they're not allowing the flowers to grow themselves. So yes, the quality is going down. I can smell it because since I don't smoke, but I trust the edibles because they are governed for how many milligrams per use. And I can actually say, okay, I need a half a gummy, a full gummy, whatever for that type of day. And that is the best thing for me. Going back 50 years, the guy off the street, you didn't know what you're getting, but now you do. I had a fight with this for myself.
Thomas? Oh, all right. Oh, Thomas, you there?
I'm here. I'm sorry,
Oh,
my computer
okay.
just dropped out. Can you
It's
hear me?
okay. Yes, we can.
Yeah, I had 3 computers die on me today, and this is my backup. I was trying to get here, so I don't know if we're caught, but this has been a godsend, and I thank everybody. I can relate to the one man. I think it was William, with the problems with losing his home, because we're in the process of that right now. But there is help out there. He needs to search out things, and people will point him in the right direction. My
Uh,
only problem is people not obeying the law on the street and walking into a cloud of somebody smoking. That's the only thing I have a problem with. If you can't drink on the street, you shouldn't smoke on the street. It's the same thing. I'm done.
Thank you very much, Thomas, for sharing your thoughts with us. All right, we're gonna go to the next 5. Oh, wait, I'm sorry. Chris L., your hand is raised. If you can please state your full name for the record, we're gonna unmute you.
Hello?
Hi, Chris.
Yes,
Yes, can you please state your full name for the record?
my name is Christopher Lenny. I'm a resident of Audubon, New Jersey.
Okay, thank
I've
you.
been a
You have
resident of the state my 3 minutes. I've been a
go
resident.
ahead.
Yeah, I've been a resident of the state my whole life. I'm a retired firefighter, retired in 2019. Started by prescription from my doctor. My comment is about the current state of the industry, which is regulated by the Regulatory Commission, has priced the patients out of the market. I'm fortunate. I have the income, but I've been going to the dispensaries for 4 years since I've had my card. And I see a lot of people that are not as fortunate as myself to have the income. But even at the small amount that I use, which is approximately it is less than a gram a day of flour, it's still in excess of $400 a month. I believe that the commission should allow patients to figure out a home grow system that works. I think that you should immediately allow patients at least 100 square feet, since square footage is how you base your licenses, and also allow them the opportunity to grow low THC cannabis, which the state of New Jersey chooses to regulate, which prevents us from getting good access to that medicine. Because again, to grow low THC cannabis inside the state of New Jersey, the New Jersey government insists on regulating and taxing it. Now, the claim that allowing home grow will undermine the industry and the commercial success of the industry does not hold water. And Washington, D.C. is a good example that residents can grow, they can gift, they can, they can get it. And Washington, D.C. currently has some of the highest prices nationwide. New Jersey is running close second. It's a disgrace. I mean, it is just really, the patients are suffering. That's why people are leaving the program. You can find cannabis cheaper on adult usage than you can on the medical side, which seems counterproductive to providing for the patients. So that's all I have to say.
All,
Thanks
all
very
right.
much.
Thank you, Chris. All right, our next 5 names: Cosette Vernon, Joseph R. Bradbury, Alex Burgos, Tracy Sett, Stephen L. Young. Again, those names are Cassette Vernon, Joseph R. Bradbury, Alex Burgos, Tracy Sett, and Stephen L. Young. All right, no hands raised. Next 5 are Latanya Green. I have Tamara, Angela Speakman, Lisa Kincaid, and Andrea Rabel. Again, those names are Latanya Green, Tamara, Angela Speakman, Lisa Kincaid, and Andrea Rabel. All right, Angela, we see you with your hand raised. The floor is yours.
Thank you very much. My name is Angela Speakman, and when it comes to conversations about plant medicine, there is a desperate need for public cannabis education. As founder of Elucidation Strategies, a cannabis education agency, and a member of the Stockton University Hemp and Cannabis Business Management undergraduate program, I work in cannabis education daily. When talking with current patients, prospective patients, and individuals who might greatly benefit from access to medical cannabis, and they often lack basic understanding, there's a lot to unpack there because it's very rooted in stigma. There are major gaps and problems in information access, problematic and dangerous misinformation, and woefully uninformed healthcare professionals. My extensive work in the canna education field exposes me to evidence, data, and real-life impact that clearly demonstrates that more focus on public cannabis education, particularly in regards to the MCP, the home grow effort, and safe practices, would benefit all New Jerseyans. We have a responsibility and duty to New Jerseyans to help them access good, neutral information, and we should not be reliant and look to everyone else, whether it's the industry or government or authority or any of these folks, where we keep trying to kick the can when it comes to who's tackling public education, when it comes to cannabis and plant medicine in general. And I wanted to make sure to share a bit about my experience because there are services and options out there. However, it needs to be carefully coordinated and more focus needs to be made on just public cannabis education in general because we are deficient statewide and there are more confused and misinformed folks than there should be. Thank you very much for your time.
Thank you, Angela. All right, the next person with their hand raised is Andrea Rabel. The floor is yours, Andrea.
Hello, can you hear me?
Yes, we can.
All right. I would like to say thank you for having these town halls. I consider them a big step forward. I would love to see one every other month when the commission has a shortened agenda for their virtual meetings. I also think it'd be nice to allow multiple choice selections on your pop-ups because a lot of times more than one issue impacts patients. Our program is at a scary point. You need to lean on the community that wants to help you and rebuild trust with the rest. We need to develop pathways for consistent communication and mutual support. Let us be a resource, but that starts with transparency. Please issue a public letter to the Senate and Assembly following these town halls with recommendations on the issues that are beyond your jurisdiction, including medical home grow, lab safety reform legislation, institutional access implementation, sales tax reform to allow med cards privileges at all dispensaries, and insurance coverage. Please don't just say it's not your job. Please show us you hear us and are on our side. Given Senator Singleton's recent letter, clearly this is an option for public communication and transparency. I'm going to try to run through a bunch of changes that we can make to the program just to open it up to more people. In terms of getting your card, right now you need more proof of address than for your driver's license. This prevents access for people with housing instability. Your MedCard registration days should include a doctor where people can bring in documentation of qualifying conditions, and that way they can be fully registered for the program on site. Our doctors are dwindling. We're at about 1,000 and a fraction of them are accepting new patients. I request these numbers included each month with the patient numbers. I would also like you to ask these doctors to have a lecture during these town halls where people might be able to get more information. Doctor discretion should be allowed for qualifying conditions. If you're going through the process of adding more Why not fix the problem at its source? Doctors can allow doctors should be able to prescribe this for the patients that they have genuine relationships with and they know could benefit. We also need you to revisit institutional access, hospital, hospice, and prison access. Any crime can be a death penalty for a patient without medicine. Last year, we were told maybe posters or an awareness campaign, but we need to understand the timeline, the plans. Do we need a legislative cleanup bill? We need to see safety in facilities and in the program. You need to simplify reporting and allow anonymous submissions. Please don't hang up on people when they're trying to report actual concerns. Timely acknowledgement of complaint emails would also help. Please clarify with all staff that customer complaints can come from the adult use side, not just medical products, and evaluate lab safety and methods, not just the cultivators. We need to see the COAs online. Please host a database of them or mandate that the providers, manufacturers, producers, cultivators have to post them publicly available. We need this information to guide our purchases, not do damage control afterwards. Right? Our medical program is more restrictive than recreational. There's documentation issues, lower limits that need to be fixed. The med discount should be on tax, should qualify at any dispensary. We need to see full spectrum CBD and hemp products. We need transparency on where our ingredients are coming from right now and a pathway for these hemp farmers into metric and onto shelves. Minors can
Okay.
extremely.
I'm sorry, Andrea, the 3 minutes is up. What I do suggest is if you can submit a written comment with the rest of your remarks for us, and we will review them.
I will certainly be submitting written testimony, and I would just like to ask if there is any limitations on the CRC writing a public letter to the Senate and Assembly with recommendations for the legislative actions that are beyond their jurisdiction. Is that even a possibility? Because I've heard other patients ask during these town halls too.
Andrea?
Yes.
Oh, I'm sorry. My microphone has been off this whole time and I just now got it to work again. We will respond to you by email. We are not equipped to answer that just this moment. We're going to take some other comments from other callers and we will get back to you by email.
I appreciate that. What email would you like me to send this to, or is it just through the public comments that you'll be?
You can submit it through the public comments. We have your contact information here when you register to speak. So we will be following up with that email.
Thank you very
Is that
much.
okay?
I appreciate
If not,
it.
you can just drop a question with the contact information and we'll copy it down from there.
That's perfect. Thank you so much.
Okay, thank you.
All right, we'll read the next group. Eric Sapp, Thomas D. Benedictus, Ismael Colon, Mashana K. Dunham, Chris Goldstein, Gina Fania, and Mark Williams. Again, those names are Eric Sapp, Thomas D. Benedictus, Ismael Colon, Mushana K. Dunham, Chris Goldstein, Mark Williams, Gina Fania. All right. See a couple hands raised. All right, Ismael, the floor is yours.
Good afternoon, everybody. My name is Ismael Clone. I'll try to make this as quick as possible, and I know I got 3 minutes. If I'm all over the place, I apologize. I'm taking notes as I listen to everything. I've been a patient since December of 2017. At that time, it's quite confusing to me and aggravating on several levels. My life was somewhat turned around prior to that, but it just got worse after that. I was actually ordered by a judge. I did ask in the question and answers prior, it seems, if anybody has any resources, I would appreciate it. In regards to, I feel civil rights of mine have been violated from a civil rights perspective. That being said, again, I apologize if I'm all over the place. Yeah, so another thing that was brought up, it looks as if patients have gone down in numbers. And that kind of makes sense to me if it's used correctly and you as the user, the adult, is using the product, you find them. And if you've been using prior, you find that you don't really need the card to an extent. When it comes to medical cost, I get that as well. Having a disabled child, may she rest in peace, where, you know, costs can get a little out of hand depending on why you may be a medical patient. But I get as to why possibly numbers have gone down, but I would be in that situation, but that's where my rights have been violated on one degree, one parallel, if anybody can help out. Where again, prior to getting the card, I didn't get any speeding tickets, no tickets at all, No, I never had an accident, etc. Fortunately, for years, I was back and forth from Bergen County to Philadelphia to do to my child. May she rest in peace. So again, when it came to driving, etc., you know, I never had a problem. There's several other variables to all of this. Thank you for bringing to my attention, Chris. I'm writing down some names as I've heard that started the meeting. I didn't know we had a right to reserve products. I do find there are certain strains, etc., that work better for me, even from. But they have to be from a. You could have the same strain with a different vendor, but it's still not the same strain. So it's good to know that you can reserve products. Mr. Williams, my empathetic to what you said. I agree with you as well. This was brought up years ago with one of the associates that worked at a dispensary. She told me, because I've been looking for support groups from people within the program for years now. She gave me a suggestion, never found anything on there. And it doesn't seem like anybody.
Ishmael, your time's up. If you have any other comments, please send them to us in writing.
Yeah, can you actually reach out to me as you were going to as Mr. Williams, so in regard to support groups, etc. It's
We
Ismael
will reach
too.
out to you.
Please.
However, I'm not sure that we have that information to provide to you or that we even can.
Okay.
So we will reach out to you and let you know what we can do.
Yeah, please. And I'm
Okay,
gonna
thank you
speak
so
again tomorrow
much.
night. So all right, thank you.
All right, Chris Goldstein, the floor is yours.
Chris, we can't hear you.
Yes, here we go. Can you hear me now?
Yes.
All right, thank you. Good afternoon. My name is Chris Goldstein, and I've been with this program since before it was a program. We worked on a law with the Coalition for Medical Marijuana of New Jersey way back in the day. And to those of you looking for a support group, CMMNJ, the Coalition for Medical Marijuana New Jersey, does have monthly meetings. And it is sort of like group therapy for medical marijuana patients. It's not official in any way. It's a group of people who work together on advocacy, and it is a good support network. So I did want to mention that. CMMNJ has been instrumental in this fight. And honestly, what you're hearing today, first, again, also, thank you for having this listening session. You invited me to testify last year, and this is something that I recommended. I'm glad that the CRC is hearing from so many patient voices. People who are in the program, people who drop their cards, people who are interested in seeing improvements. In 2025, you know, when we started this effort 10 years ago, we didn't envision that it would take this long to make it so mainstream. We would have hoped that by today, you would be able to have an insurance subsidy for medical marijuana, and you'd do a copay and get your ounces for free. There are actually bills for that in the legislature. But as you heard today, because of its completely out-of-pocket expenses of medical cannabis in New Jersey, most patients struggle with the costs. And what's weird is that a few years ago, well, almost 4 years ago now, the main operators were before this very commission with promises and patient access plans. I heard these large operators, before they got their permits to sell adult use, promise to have discounts, promise to have special shopping hours, promise to improve the medical marijuana program. And I'm here to say that all of those promises have been broken. I track the prices of the large operators, not just in New Jersey, but in other states. Curaleaf charges $18 for an eighth in Pennsylvania, but $45 for an eighth in New Jersey. Air Wellness, $15 for an eighth in Pennsylvania, $32 in New Jersey. Why is it that patients are being price gouged and charged double in the Garden State? Now, we can address this with legislation, but the CRC, as I mentioned last year, has an important role to negotiate better prices for patients, and that will improve the program. In Pennsylvania, where the eighth is 18 bucks, they have 500,000 registered patients today. In New Jersey, where it's 45, we have just 66,000. I'm here to tell you that if we can affect the price down and equalize it, even with the states next door, we can improve this program pretty much overnight. Again, thank you for hearing all of these voices. I think this is a critical health program for public health in New Jersey. The CRC has an important role here. Thank you for listening.
Thank you, Chris. To pass it over to Christine, she will take over.
Okay, so if you are here and you have not already spoken and you would like to say something, please raise your hand. If you're here and you have not already spoken, please raise your hand. If we haven't heard from you and you want to say something today, please raise your hand. I see Ken Wolski. Okay, Ken, you are live.
Thank you. My name is Ken Wolski. I'm a registered nurse in New Jersey. I've been an RN for 49 years here, and I'm executive director and co-founder of the Coalition for Medical Marijuana in New Jersey. In 2018, the Jay Koenig Act called for institutional caregivers in the state. These caregivers are employees of healthcare facilities who are authorized to assist registered qualifying patients or residents of the facility with the medical use of cannabis, including obtaining and using medical cannabis. But currently, most, if not all, New Jersey healthcare facilities forbid the use of medical cannabis in the facility. This is a dangerous and potentially fatal situation. A patient who suffers from seizures may be admitted to a healthcare facility and then denied access to the only medicine that controls their seizures, medical cannabis. Why? Healthcare facilities are afraid to lose federal money if they allow Schedule I substances in their facility. But the feds have been forbidden to interfere with state medical programs, so this doesn't even seem like a reasonable objection. In fact, Ryan's law in California allows any hospice patient to have access to medical marijuana, and there's been no federal repercussions. Marijuana is a mainstream medicine, but there's still a great deal of ignorance about medical cannabis. Every year in New Jersey, doctors and nurses are required to take certain continuing education courses to maintain their licenses. So the CRC should require education on the endocannabinoid system for all healthcare professionals who have prescriptive privileges in the state of New Jersey as a condition for continued licensure in the state. The New Jersey Department of Health's Executive Order number 6 from 2018 also said that the Department of Health should develop provider education programs and dosing and administration guidelines. But we still haven't seen these as far as I know. And finally, there's a bill in the legislature right now to add sickle cell anemia as a qualifying condition for the medical program. But adding qualifying conditions to the medical cannabis program is time-consuming and inefficient. The CRC should allow anyone with prescriptive privileges in New Jersey to recommend cannabis therapy for any condition that the prescriber feels may be helped by medical cannabis. Leave this up to the physician to act in the best interest of the patient. The state of New Jersey has already approved numerous conditions as qualifying for cannabis therapy. Therefore, cannabis should be allowed to be recommended off-label for any other condition, as is the case with prescription pharmaceuticals. Thank you for allowing me the opportunity to address this commission.
Thank you so much, Ken. One more time, if there's anyone here that has not spoken before and would like to speak today, raise your hand. If you are on your cell phone or a landline, the code to raise your hand is *9. To unmute, it's *6. Is there anyone else? No one? Okay, so thank you so much for joining us today. If you want more information about the New Jersey cannabis, go to nj.gov/cannabis. If you would like to visit our safe use page, it's also nj.gov/cannabis /cannabis/safe use. I promise I am 100% sober right now. Thank you so much for joining us. We have another town hall tomorrow at 6 p.m. You are, the registration to speak for that one is closed, but you can always submit your comments in writing. And if you have questions, if you have comments not related to medicinal cannabis, you can feel free to visit our meetings page to join a public meeting and submit comments there as well. Thank you so much and enjoy the rest of your day.